I'm going to give you the crash course on child CPR. Again, as I've said in my disclaimer, this is not obviously a full instruction, and you should take a regular class so you know how to do this. I hope you never have to do this. I've actually never physically done CPR on a child. Luckily, I guess, the calls I've gone to involving children have always been so traumatic that there was no reason to do CPR. I have done telephone CPR with a couple of parents on children when I worked as a dispatcher. It's just an awful situation, but it's definitely something you need to know in case you have to do it. Child CPR is basically the same as adult CPR. You're going to want to get the child flat on its back. You're going to want to expose the child's chest. You're going to find that spot on the chest by taking 2 fingers up from the divot in the bottom of the rib cage called the xiphoid process. You're going to place one hand in the center of the chest at the top of your 2 fingers. Place your other hand on top of that hand and interlock your palms, lock your elbows, and depress. You're going to do 30 chest compressions. You're going to push down about 2 inches. And just for a side note, in the past, when I worked for the fire department, if you did child CPR, it was one-handed. One palm on the chest, pushing down, not both. I'm not sure why that changed, but the new standard is both hands like the adult. After you've done 30 chest compressions, you're going to give 2 breaths. Again, you're going to do the head tilt chin lift method. One hand on the forehead, your palm of the hand on the forehead of the child. That same hand, you're going to pinch the child's nose shut and pull the head back, and assist this motion with your other hand by placing your hand under the jaw and lifting. You're going to open the child's mouth, check for obstructions. If there's an obstruction that you can easily get to and get out, get it out. If you cannot easily get it out, leave it there. You don't want to push it further down into the child's throat. You're then going to give 2 long breaths. You're going to watch the chest and make sure the chest is rising and falling as you breathe in and let the air out. You're going to continue doing this until the child comes around or somebody with more medical tools shows up, like an AED, a defibrillator, or a doctor or something like that. But I'm giving you these instructions in the event that there is no ambulance, no 911, no hospital to go to. As I stated before, most patients that are going to need CPR are probably not going to survive. Now, if the child has drowned and you recently pulled them out of the water, like within minutes, that child, I would say, has a good chance of surviving if you perform CPR correctly. As with the adults, you will probably break ribs. You'll feel them snap while you're doing compressions. That's normal. It's okay. Don't stop just because you feel that. And the child will more than likely vomit like adults do. And you need to get the vomit out of the child's mouth as best you can and continue giving breaths as best you can. If you're putting together some kind of trauma kit, I would suggest that you get some kind of suction device. Amazon sells manual suction devices that you can use to suck vomit out of somebody's mouth. And I would also suggest that you get a air mask with a one-way valve. This way you're breathing through the air mask into the patient's mouth, and that eliminates the vomit going into your mouth. If you want to get really fancy, you could get yourself a bag valve mask that you just squeeze to put the air into the patient, and they're pretty effective. Again, this is the crash course. You need to seek out full direction, a full class from a certified CPR instructor, either online or better to do it at an in-person class where you can actually practice on a dummy. I have been a CPR instructor in the past, but I am not now. Again, that's 30 chest compressions to 2 breaths. And of course, like adult CPR, you're going to want to make sure beforehand, obviously, that the heart is not beating by checking for a pulse, that the child is not breathing by listening near the mouth for air exchange or watching the chest rise and fall. If you observe agonal or gasping breathing, that is not effective breathing, and you should still do rescue breaths. Anyway, this is the very basic. Just so you know, most people know this stuff, but it's always good to keep it in mind in case you ever have to do it. I hope you don't ever have to do it. This is the time to get prepared, to learn as much as you can about this stuff, and always ask yourself, will you survive?